So you're going to graduate in week 1?
I haven't heard anything back from the body. And of course, depending on what is going on with that patient, they might have more than one drain. And there's a huge variety of different types of drains. Of course, you guys know there's chest tubes, which is, of course, considered a drain. And then there's just the regular drains that are used for in surgery, like JP and Hemovac and all those. So just kind of be familiar with them when you're going in to do mainly bigger, larger procedures where you think there's a good possibility they might need a drain. And sometimes you're just doing a procedure and the surgeon says, I want a drain, and they'll tell you what they want. So you'll learn them, and you'll learn which ones are the most common that they use.
And the fact that when they don't want it to be yanked out, they tie it, tie it.
Yeah, they usually suture the drain in place so that way it doesn't get yanked out. Patients do things. I mean, you would think, why would a patient pull out their drain? But they do. They pull out everything they can. So it's not uncommon. Let's see, dressings. You guys are familiar with some of the dressings that we use in the OR, right?
Yes. So
peri pads and abdominal pads and all types of different tape. Telfa, Steri-Strips, all those are dressings. So really, again, kind of going back to, it depends on what the surgeon likes to use for that procedure and how big the incision is. You know, they're not going to do a big open belly and just put Steri-Strips and that's good enough. They're going to cover it up. I always tell patients it looks a lot worse than it is because they can have just a small little incision on their hand and it's wrapped up like they cut like from here to here, but the surgeon likes to make sure they protect it from hitting it and things like that. So they'll overdo dressing on patients a lot. So yeah, usually to tell the patient, don't worry about that dressing. That if you look at it, you're like, that? They put that much dressing on that? Yeah, like carpal tunnels, they put quite a bit of dressing because they want to protect it. But yeah, it's small incision. And again, all kinds of different types of dressing out there, and it's dressing is to help keep that area clean, and it should promote healing. So people don't pick at things, just to keep it clean from everything else. You know, if they're working on their motor and get stuff.
Itches, so you still have to do this through the dressing.
Yeah. And then you peel off your stitches and have to go back and get some more.
I actually haven't done that yet. Haven't taken them all out. Taken a couple of them out. Haven't taken them all.
Oh, good.
You need that German bug, well, depending on what it was.
Yeah.
You just need extra stick on you.
Yeah, and people will try to pull out their own staples, and it looks like, you know, staples you would think it just goes straight down, but they actually curve in like that, and so when they're trying to pull them out, they're causing more damage.
Yeah.
So yeah, you have to take them and kind of twist out with them. So don't try to take out your staples.
So
if you
there's
ever
no
get
staple
any.
removers?
They have staple remover kits, you know, that the surgeon will use to take out staples in the OR sometimes when the patient comes in and they need to maybe debride it or something. So yeah, and they come out really easy. You know, like the staple removers, kind of similar.
Similar to it.
Yeah. Do you guys have any questions about drains or dressings? All right.
Would that stuff would come in the kit that they need?
The dressing?
Yeah.
Sometimes, you know, those kits are made up for what most people use. So sometimes it doesn't have like Steri-Strips. Sometimes, well, a lot of times they don't have staplers, and well, of course, staplers is in the dressing, but you know, so stuff like that, they don't come in.
So then if they wanted it, who would we
The circulator.
Circulator?
Yeah, and also if you look at the preference card, it'll tell you what kind of dressing. Yeah, and if you're not sure, like, I don't know, on your pack, on the pack before you open it, it'll tell you exactly what kind of dressing is in there. So if you can remember to read what's in there. All right, Tegan is going to talk to us about suture, ligatures, ligating methods, suture for the procedure, and everything else you can think of. Right, Tegan?
Yes.
And I think she's going to go to it, so let me turn this on. I'll keep myself on here a little bit. I think it's Katrina and Megan's stuff.
I don't want to write his name on the front.
I like this. I don't call it. I saw he had liked something. I'm like, watch it. And he put it on. I was like, I might be with you.
My daughter.
That's true too. I just tried
So is it Dell or Dale? It's like,
It's Lydell.
so Dell.
Yeah, Dale. Are you guys thinking like DELL? Or I always put DALE.
That's what I thought.
Yeah, I always, that's what I, whenever I write them a email or something. You've never said anything about it.
Okay.
You guys got him a card?
Yeah.
That's nice. Yeah, I thought about that. I thought I need to get a card. Have you guys signed what you guys thought?
Yeah, whose idea was that anyway?
Very
Thank you.
Yeah. It's kind of late. That's how long it's really hard to find a sympathy card. Yeah, and it's at the time, it was like 11:15. Go.
A good place to look for cards is Safeway. I like Safeway's.
Yeah, they have good cards.
Good selection, yeah.
Think about that.
Did you go there after work?
Hmm?
Did you go there after work?
No, I went there like right before class.
Oh, I thought you meant like 11 last night.
No, I feel like today.
I love this.
Yeah.
It's good. I put mango, pineapple, and plain. I haven't tried the plain. I tried mango and plain.
Does it have stuff in it?
Yeah, it's aloe vera. It's what? It's so very good. Actually, there's two parts.
Yeah, they don't work in Spanish.
Who needs a pen?
Or my glasses.
They need to.
Oh. Did you get this one, number 15, for what procedure it is and can be performed in the room as one two?
Do not hear that.
This one stumped me. I was
think
like,
you told me it was
skip it.
It is. I don't think he'll be ready, because it sounds like he's gonna drive and then tomorrow's the service. And then come back.
Irrigation.
And then driving. Irrigation.
Oh,
Driving.
yeah. That's what it was.
Remember how far he said it was 12
You're
hours,
irrigating.
14 hours. I
Right,
can't
it's
remember.
Yeah.
Where's it going?
Oh, right, with foreign
Somewhere in
material
Texas.
is
I believe it says love it.
Lubbock.
I was like,
His wife was gonna go.
well, Lubbock is already.
I'm assuming that's infection.
Wait, what?
I never use my Microsoft email account, so I can't remember.
Backwards. My computer, of course, doesn't work.
Placement of a move out of blue tray and careful approximation and pressure dressings. Up to avoid. Did we just send that yesterday?
I think so.
What number is that?
Yeah, I can ask her to sign
I got it
it.
this time.
She'll be back tomorrow.
Oh, that's space.
Oh, okay.
Yep. And the other one, 44 ounces. Dermaphone. Or is it what intermittent? And what?
And then this next.
Two questions.
Suture dispenser boxes contain 1 to 3 dozen suture packets and provide clear product identification through color coding, bold graphics, and descriptive symbols. The important information that the surgical technologist should learn to look for on the box is suture size and material and the type of and size of the needle. Other important information displayed on the suture box include surgical application, product code number, suture length and color, metric diameter equivalent of suture size and length, shape and quantity of needles shown in the silhouette, needle point geometry, lot number, and expiration date if necessary. This is an example of an undyed braided vicryl glycogalactin 910 suture. You can see the needle, shape, the size of the suture, how long it is, just a little rundown. Ligatures, also referred to as ties, are used to occlude vessels for hemorrhage control or for organ or extremity removal. For example, the occlusion of the femoral artery is necessary to prevent hemorrhage when amputating the leg. Typically, vessels that are not coagulated or occluded with stainless steel clips are ligated with suture. Ties are available as full-length or pre-cut suture strands in a package, or wound onto radio pack reels for superficial bleeders.
I meant to say round. The ligating methods: free tie, ligature reel, instrument tie, suture ligature. It's just some of them. But I got some videos. Let's see.
For trying to answer, the suture should be brought. For a triumph cancer, the suture should be brought around the clamp and brought down in a tip-to-tip fashion. This allows the suture to be hooked underneath the clamp. The knot is then brought down with the forefinger, and the throw is pushed just past the clamp. Communication with the assistant is essential. The assistant should not remove the clamp until you tell him or her to do so. Additional throws are then brought down and again pushed just past the knot. Scissors are then brought down in the hole to cut the tails.
All right, so final video. Here we'll be teaching you about the instrument tie. Now, this is what you're going to be doing generally if you're kind of starting off or finishing a running baseball stitch or something similar. Any kind of running stitch, you're usually going to anchor in the end of an incision using an instrument tie. This is going to be a very, very popular one. You're going to use it a lot. So what you're going to be doing, you're going to have a length of suture in one hand. Suture is definitely the best to use to learn this one, just because this stuff is just way too thick to kind of make it easy. So we're gonna actually use suture for this one, and you're gonna use your instrument in the other hand, in your dominant hand. I'm a righty, so I'm using my right hand. And always when you're using an instrument that has kind of holes for your fingers, always use your thumb and your ring finger. Never use your middle finger. You'll get called out on that on the awards a lot if you do it. So always use your ring finger, just because it's easier to, you can control the tip, you can kind of have a better grip on it with this. It's just better overall. So that's what you're going to want to do. So you're going to have your instrument in your dominant hand, thumb, and ring finger, and you're going to have the suture in your other. So what we're going to do is, if we were actually using pigskin or something similar, or we're stitching up a human body, what you usually do is, from a righty's perspective, I would anchor it in the farthest side of the incision I'm trying to stitch up. And what I would do is, if there's a needle on this, I would plunge it into the skin. I would push it across the wound, and I would pull it up from the other side, and I would basically just keep pulling it until I had this tiny little tiny tail sticking up out of the skin. Now, because it's not anchored in actual skin, I'm gonna leave it a little long just because it's easier to manipulate, but you'll get the idea anyway. So what we're gonna do is we're gonna hold the long end of the suture in my left hand. I'm gonna have my empty needle drivers in the right hand. What I'm going to do for the first one is I'm actually going to loop it over the needle drivers twice. So I'm going to go from left to the side, from the side that it's on to the side of the short end. And I'm going to loop over the top of the needle drivers, and I'm just going to finish the loop. And for the first one, I'm actually going to do that twice. So you'll see there's 2 loops on the end of that. And then I'm going to use the tips to grab the very end of that suture, and the reason you want the very end of it is because if you grab it too close, you'll leave this tail that's sticking on the other side, and it gets all messy. You don't want to do that, so you just want to grab that short end, and then instead of pulling everything through, what you want to do is essentially just pull the loops off the tip of the needle drivers. And for this first one, again, you're going to have to cross your hands to make it lay nice and flat. You can see that it lays nice and flat. If I do it the other way, it gets all twisted up. So I'm going to lay it nice and flat by crossing my hands, and now the short end should be on the other side. Okay, so you always want to have the short end flipping back and forth. So the short end is now on the left, so my needle driver is going to start on the left. So what I'm going to do is I'm going to just do the exact opposite. I'm going to bring the long tail, the long through tail with my hand over the top to the left and finish the loop. I'm going to grab the tip of the suture with my needle drivers, and then I'm going to pull the loop off, and then my hands should go back to where they were, because we're always going to pull the short end to the opposite side. So it should always be, again, bouncing back and forth. So again, start off, notice I'm only doing 1 loop over the top, grab the tip, and so this time I'll grab fairly long tail, and what you'll notice is that it leaves a long tail kind of hanging out on the other side of the knot. So what I have to do is just like tug that through, And if you tie it too tight, it's gonna be really difficult. So that's a pain in the ass. So that's why you always want to.
I didn't notice it at first.
And then short end to the other side. What we're gonna do is we wanna loop over the top, go in the opposite direction. Grab the tip of the short end and pull through. And again, that's why you want to keep this relatively short because otherwise it's a pain in the butt. So now if this were at the end, what I would do is I would just kind of do my running baseball stitch over the top a bunch of times. Okay. And then if I was gonna tie this at the other end of the stitch, I would do it one more time through, but I would leave this a bit long. Okay. So I'm actually gonna leave a little bit of a loop out here. I'm gonna use this as my long end. So I'm gonna loop that twice. I'm gonna grab that kind of loop that I left. I'm gonna pull the entire loop through. Okay, so now I have this little double-stranded loop over here. All right, and then what I'm gonna do is I'm just gonna put a couple instrument tie knots in there. And I should be left with a loop on one side of the knot and a long tail on the other. And that's anchored nice and tight on both ends of the incision. And then you just you snip your long ends here, and the double one here. And that's it. So that's your instrument tack. And you just learned all the major knots in surgery. So get out there and save some lives.
All right.
I read something when I was looking for, there wasn't very many good videos covering the last couple of pages of my instructor. Anyways, that a surgeon had won a knot tying contest, like against like fishermen and everything. I thought that was pretty cool. And that's a pretty cool.
Yeah, they're pretty good. Really good behind knots. Yeah.
And Delvin is so fast that video is like kind of cool to see how it really.
Yeah, we have one of those boards that is, you guys seen it?
The Ethicon boards.
Yeah, one
Yeah.
of those Ethicon, so you can practice. I mean, you guys aren't gonna be suturing anything until you take our first assist program, so.
That's later, but next.
Yeah.
That's later, when you guys get a couple of years of experience under your belt, right?
Yeah.
Yeah. All right, I can't remember who's up next. Katrina, is it you or Megan? I think Megan, huh?
For absorbable sutures?
Yeah, I think so. Did everybody sign?
So how do you pronounce tense? I think I pronounced it wrong the whole time, guys. So.
Sutures.
Plain gut. Plain gut sutures are made from collagen from serosa or beef intestine or the submucosa of sheep intestine. The absorption rate is through an enzymatic digestive process that is complete within 70 days. The tensile strength is maintained for 7 to 10 days, and the general usage is for ligating superficial blood vessels and for subcutaneous. Also, it is absorbed faster in the presence of infection, and it's not used on tissues that are under stress. Chromic gut. The absorption rate for chromic gut is complete within 90 days. The tensile strength is maintained for 10 to 14 days, and the general usage is the same as plain gut. Also, chromic gut is plain gut, but is treated with chromium salt solution to prolong absorption rate. Absorbable synthetic monofilament sutures. Polydiaxanone. The absorption rate for these is slow hydrolysis, minimal until the 90th day, and complete within 6 months. The tensile strength is 70% at 2 weeks, 50% at 4 weeks, and 25% at 6 weeks. The general usage is for all types of soft tissue approximation, including orthopedics, gynecology, eye, plastic, digestive, and pediatric CV. PDS plus antibacterial. The absorption rate is hydrolysis and 183 to 238 days. The tensile strength is 60 to 80% at 2 weeks, 40 to 70% at 4 weeks, and 35 to 60% at 6 weeks. The general usage is same as PDS2, except no contact with cornea and sclera. I don't want to mess up the name for this one, so I'm just going to say monocryl. The absorption rate for monocryl is through hydrolysis, and it takes 91 to 119 days. The tensile strength is for undyed, all strength is lost by 21 days. If it's dyed, all strength is lost by 28 days. And the general usage is for soft tissue approximation and or ligation. Monocryl plus antibacterial. The absorption rate is through hydrolysis, and it's 91 to 119 days. The tensile strength, wound support for about 14 days, and the general usage is the same as monocryl. Polyglycinate. The absorption rate is through hydrolysis and is complete within 6 months. The tensile strength is 75% at 2 weeks, 65% at 3 weeks, and 50% at 4 weeks. The general usage is for soft tissue approximation, pediatric CV tissue, and PD tissue. Biosin. The absorption rate is 90 to 110 days. Tensile strength is 75% at 2 weeks and 40% at 3 weeks. And the general usage is for soft tissue approximation and ligation and eye surgery. Caprosin. The absorption rate is 56 days. The tensile strength is 50 to 60% at 5 days, 20 to 30% at 10 days, and none by 21 days. The general usage is for soft tissue approximation and ligation. Absorbable synthetic multifilament sutures. Polygrafted 910, or also known as Vicryl. The absorption rate for Vicryl is minimal for 40 days and complete in about 50 to 60 days. The tensile strength for 6L and larger is 75% at 2 weeks, 50% at 3 weeks, and for 7L and smaller, it's 40% at 3 weeks. The general usage is for tissue that requires long-term tensile strength, but absorbable suture desired, soft tissue approximation and or ligation. Polygrafted 910 coated. The absorption rate is minimal for 40 days and complete between 56 and 70 days, including coating. The tensile strength is 75% at 2 weeks. For 6L and larger, it's 50% at 3 weeks. For 7L and smaller, it's 40% at 3 weeks. The general usage is for soft tissue approximation and or ligation and for eye procedures. Vicryl plus suture. The absorption rate is 56 to 70 days. The tensile strength is wound support for about 4 weeks. And the general usage is the same as Vicryl, except not for use in the eye, CV, and neurologic surgery. Polyglycolic acid or Dexon. Let's see, the absorption rate is complete within 30 days, and the tensile strength is 50% at 21 days, and it's generally used for tissues that require long-term tensile strength, but absorbable suture desired. It's also used for general soft tissue approximation and/or ligation, including eyes. Polysorb. The absorption rate for Polysorb is 56 to 70 days. The tensile strength is 80% at 2 weeks and 30% at 3 weeks. And it's used for soft tissue approximation and ligation and also for eye surgery. Some other information is it comes braided and it has good knot security.
Huge.
That is a huge move.
Yeah. That's a lot of suture.
I did it and I still
Some of those are familiar to me, others aren't, like Daxon or whatever that one isn't. These ones that are on the board, those are all familiar, things that you'll see. Pretty normal to see all those. Those long names that are on suture, those are not like the common names that they're gonna refer to the suture. So like, PBS, that's what they call it, PBS, instead of that long name. Same with Vicryl, Vicryl, all of them, they always refer to them by that shorter. All right, Katrina.
Couldn't find it. Turn the volume.
Yeah, like when you hit like record, you know, it takes you to like the mix part. Like underneath, like where you could see yourself if you record your face, like there's a little microphone and you can turn it down. Mine's
I
like,
didn't see that.
you didn't?
It's also in a tab, you can like choose the volume instead of like adjusting it like on a bar, you can choose medium, high, or low.
Oh, really?
And you can do that with your music too. So you can
So
have
do
like
you
low
do
music
that-
and high volume for your voice.
Do you normally have like low or medium for talking?
If I'm gonna do music, I put it on low, and if I'm talking, I put it on medium. And then it depends on how close you are to your mic.
Yeah.
So if you like start out real close and you're reading it, to be loud at first, and then you back up as you're reading it.
Yeah, you can tell.
I never
when
closer.
somebody-
I'm always like further.
You got a good mic.
Yeah, because mine is like almost all the way down, because whenever I first did it, that's what was going on with me. Since I turned it down, it's gotten better. So.
Non-absorbable synthetic meaning nylon. Non-absorbable synthetic meaning nylon can polymide, polypropylene, polyesters, polyethylene, polybutyester, and polyvinylidene chloride, PDDS sutures. The natural can be silk, and the metallic can be the stainless steel. Monofilament can be made of a single thread-like structure, and a multifilament consisting of a multiple thread-like structure braided or twisted into a single strand. And here are some advantages of the monofilament and the multifilament. The monofilament sutures are stiffer, less tissue drag, less reactive to tissues. They maintain tensile strength longer and avoid contamination. The multifilament is more flexible, more tissue drag, more reactive to tissue, less tensile strength, and more capillary action. Non-absorbable synthetic monofilament. Nylon, the tensile strength degrades at a rate of 15 to 20% per year. Tissue reaction is minimal. The general usage is general soft tissue approximation and nerve ligation, including cardiovascular and neural tissues and microsurgery. Supermed, tensile strength is good. The tissue reaction is minimal. The general usage is on soft tissue, approximation, skin suture, and plastic surgery. Poly tester, the tensile strength is excellent, tissue reaction is minimal, the general use is tissue that requires long-term tensile strength, running subcutaneous closure in a blood vessel, anastomosis. Polypropylene, also known as proline, tensile strength is excellent, tissue reaction is least reactive of all synthetic materials, general usage, frequent use in general, orthopedic, plastic, cardiovascular, and urologic surgery. Polytetrafluoroethylene, the tensile strength is excellent, tissue reaction is minimal, the general use is soft tissue approximation, bone grafting, soft tissue implant, and plastic surgery. Stainless steel, the tensile strength is indefinite, tissue reaction is minimal, the general usage is abdominal wound closure, hernia repair, sternal closure, circlage, tendon repair, bone repair, retention, sutures, and respiratory tract. Gore-Tex tensile strength is excellent, tissue reaction is minimal, the general usage is anastomosis of vascular grafts, the mitral valve repair, the chordae tendineae repair, the carotid endarterectomy, the hernia repairs, the pelvic floor repair, and the robotic surgery. Non-absorbable natural synthetic. Surgical silk, the tensile strength, loses most tensile strength in a year. Tissue reaction, less than plain or chronic gut, but more than synthetics. General usage, serosa of the GI tract, fascia, frequently used for suture ligatures. Non-absorbable synthetic multifilament. Nylon, Neurolin by Ethicon. Tensile strength is excellent, but gradual loss occurs over time. Tissue reaction is minimal. General usage is a general soft tissue approximation when continued strength is needed. Commonly used for neurologic closures, used in eye and cardiovascular surgery. Brelon by Covidian. The tensile strength is excellent, tissue reaction is minimal. General usage is used with endostitch for a variety of laparoscopic MIS procedures. Polyethylene terephthalate, also known as Ursulene. The tensile strength is excellent, no significant change known to occur. Tissue reaction is minimal. The general usage is general soft tissue approximation and ligation. The eye, the surgical, cardiovascular, and urologic surgery, and the respiratory tract. The polyethylene terephthalate coated with polybutylate. The tensile strength is excellent. Tissue reaction is minimal. The general usage is general soft tissue approximation and ligation, commonly used to close incisions of the heart. Dagrin. The tensile strength is excellent. The tissue reaction is minimal. The general reaction is soft tissue approximation and ligation, especially useful in respiratory tract and cardiovascular procedures. Tycron, the tensile strength is retained indefinitely. The tissue reaction is minimal. The general uses is soft tissue approximation and ligation. The eye, the cardiovascular, and urologic surgery. And also it has excellent security with prosthetic implants and has a good knot security. TED-DEC. The tensile strength is excellent. The tissue reaction is minimal. The general reaction is soft tissue approximation and ligation, eye, orthopedic, cardiovascular, and urologic surgery. Polydec. The tensile strength is excellent. The tissue reaction is minimal. The general use is soft tissue approximation and ligation. The eye, orthopedic, cardiovascular, and urologic surgery. Fiberware, tensile strength is excellent. Tissue reaction is minimal. The general usage is orthopedic surgery. Soft tissue repairs such as tendon and rotator cuff repairs. But the most commonly used high tensile strength sutures used in orthopedic surgery.
Good job.
So most of those, the tensile strength was excellent, so that means it's gonna last forever or indefinitely on most of those sutures. Yeah, it can be, trying to remember all those, but thankfully you guys will never have to remember all those sutures. Yeah, that would be a good session.
Yeah, that'd be interesting. Excuse me, Doc, you sure you have the right one? I read in class, that this is best used for kids.
Yeah, I want to see you do that. That would be interesting.
I read in class that this is not the best suture for what you're doing.
Yeah, this is the best suture for the job.
And he'll say, your name is Dr. What?
I come out with my fingers sutured together well, you know. It is strong enough.
Probably more like your lips. You're like, come here, let me fix that problem you have there. All right. Now it's time for questions about the test, about the review. What? No, you're supposed to ask me questions.
I'll just take the question. Yeah, we'll just keep going.
Just keep on. Huh?
So collagen fibers interviewed during which phase of wound healing? That's my question.
What the question is
We're going
that?
through all of them, right?
Oh, the number one question, huh? What phase is that?
Phase 3.
Also known as?
Maturation.
Right, you guys know this stuff.
Well, we're just going over just in case.
So what, number 2 there, a wound that gradually fills in by granulation heals by what intention?
Section intention.
Inflammatory process is what phase of wound healing?
Phase 1.
Lag phase or inflammatory response phase.
Right. And how long does this take to occur? Yeah, I guess I need to add long.
Minutes of injury and lasts approximately 3 to 5 days.
Yes. Under ideal conditions, which type of healing occurs during first intention?
Primary union.
Yep. And then the question 5.
Primary union.
There you go. Yep. A hernia repair with no breaks in technique would be considered what class of wound?
Class 1. Clean.
Yep. Usually, if it says no breaks in sterile technique, it's always going to usually be that 1. What's an example of a chronic wound?
Pressure sores.
Cubitus
ulcers.
Yes. Yep. So pressure sores, decubitus ulcers. A vaginal hysterectomy with an AMP repair would be considered what class of wound?
Class 2.
Contaminated.
Right. A patient with an immunosuppressed status may be suffering from what conditions or treatments?
Congenital or conditions like AIDS or HIV.
Right. Or it could be they could could be going they could have cancer, they could be going through chemo or radiation, right?
Or had an organ transplant.
Right. Yep. A purulent wound that is debrided and applied a medicated packing, then sutured later, would heal under which intention?
Third intention.
Right. So placement of a wound drain, careful approximation, and pressure dressings help to avoid what potential problem?
Dead space.
Right.
Infection and other complications.
Yes. If a wound eviscerates, what needs to take place?
Immediate
surgery.
Right. Immediate surgical intervention. What is a keloid scar and who is prone to these types of scars?
Hypertonic
scar formation
occurs most frequently in dark-skinned individuals.
Right. Fascia provides what layer of support in a surgical wound?
It's the primary
Primary
support, soft tissue structure. And
Yep.
Primary
Okay.
support, but
muscles.
Primary support, soft tissue structure.
And it has the greatest strength. What procedure is or can be performed when a wound has foreign material or contaminated debris? Right, debridement. IND, irrigation and debridement,
Debridement, not debridement.
not debride.
Not debride, okay.
What is the term for protrusion of viscera through all tissue layers?
Evisceration.
Yep, evisceration. Tissue approximated too tightly can result in what? Ischemia.
Ischemia.
Kills it. What is normal protective response to tissue injury?
Inflammation.
Right, inflammation. What type of needle is used on friable tissue and what organs are considered friable?
Blood points, kidney, and liver.
Yes. Who is credited with creating principle of proper tissue handling and suture?
Dr. William
Halstead.
Halstead. And they have a needle driver named after him, right?
Yes.
What is the best suture needle to use for minimal damage to tissue?
Swaged.
Swedged.
Swedged.
Swedged. Permanently swedged eyeless needle. Another name for a stick tie?
Suture ligatures.
Right. Suture ligatures. What is a cutting needle most commonly used on?
Skin.
Yep. So skin,
Making tough.
Tough stuff.
Tough tissue.
tough. Silk is a natural multi-filament suture classified as a what?
Non-absorbable.
That cannot be detected after 2 years. Some sutures are coded to provide what?
Smooth passage.
Smooth passage and easier.
Yes, smooth passage and easier handling. A suture that is inconsistently when it comes to tensile strength and has a rapid rate of absorption is, yes, plain surgical gut. What does plus mean on a suture package?
Antibacterial.
Yep. Polytetrafluoroethylene is also known as what? Gore-Tex.
Cortex.
Stainless steel suture is considered the most what? Suture? Inert.
Inert.
Yes.
Reactive.
What is one main reason bolsters are used with retention sutures?
Cover the retention sutures and prevent them from cutting into the skin.
Yes, to prevent sutures from cutting the skin. What are used to occlude blood vessels?
Ligatures.
Ligatures.
Right, ligatures, yes.
Ligation
Yes,
clips.
and you're right about clips too.
Ligation clips.
What does tensile strength of a suture mean?
The amount of pull or tension that a suture strand will withstand before breaking.
Yes.
Expressed in pounds.
Yep. What needle is used for insufflation?
There's
There's needle. What needle has a cutting edge on the outside curvature of the needle body?
Cutting needle.
Reverse, yep. An NATO suture would most likely be used during what type of procedure?
Vascular and eye sutures.
Yes. What type of needle is a Keith needle?
Straight body.
Solid.
Yes, straight and it's solid bore.
Solid what?
Bore.
Solid bore. Solid.
What sutures are packaged wet?
absorbable natural.
Natural absorbable, yes. What sutures would be contraindicated in an infected wound? Plain gut. And which suture type would be recommended? Yes, monofilament. What absorbable suture provides the most extended wound support? PDS Plus, yes. She knows her suture. Know it. All that stuff she went over, huh?
Yes.
What monofilament non-absorbable suture is most commonly used cardiovascular and ophthalmology procedures?
Nylon
Polypropylene. Yes.
or proline? Is that the other name?
Polypropylene, I think it is propylene. What suture is commonly used for vascular anastomosis? So instead of a suture type, it's kind of asking more about the needle.
Is it a 4 and 5 synthetic monofilament or double arm taper needles?
Yeah, so the main things to remember about that is double arm and that it's non-absorbable. And you guys understand about double arm suture, right?
It's a suture with 2 needles.
Right. So if you pulled it out on this
Kind
end,
of how like it sounds.
yeah, it is. It has a needle on this end and one on this end. So when you have a vessel, they can start at each end and they meet in the middle. They have one on this side that they'll do and one on this side. And that's mainly for, if something broke in the middle of either one of those, it's not going to be like, oh man, we have to redo the whole thing because it met in the middle. And you guys will see them using double arm sutures on vascular procedures quite a bit, like always. Polyglactin 910 is an absorbable mesh. You should know that.
I thought it was just asking if it was absorbable.
Yeah.
Yes,
I said yes.
Yes. I thought you were saying it's absorbable. Yes, okay, it's absorbable.
Oh, it should be absorbable blank.
Yes, it should be, huh? I'm going to change that.
I put yeah.
I was like, that's an easy
So
one.
did I.
Yes.
That's an easy one. Yes.
Yeah.
So it's an absorbable mesh.
Yep. Let's see. Danielle, vessel loops come in a variety of colors. What are they?
Blue, red, white, yellow.
Yeah. Yep. Cyanoacrylate is also known as Dermabond. Yeah, that other name, yes. And then on the other one that you guys did online, I know I haven't gotten to correct the rest of them, so I'll get on there and do that. But it did let you see what the correct answers were, right? After you did it? Okay.
So we need to learn the online ones too.
Yeah, I would study those too.
Okay.
All right. See, you guys knew all the answers.
So for 42 on what structure or suture is commonly used for vascular anastomosis is pretty much that it's double armed and it's a synthetic.
What number?
For 42.
Oh, 41?
41.
Yes, that it's double armed and that it's non-absorbable.
Okay.
Anytime you see vascular, always figure they're going to probably use a double armed needle. Okay. So tomorrow I'm going to give you guys a test. You guys can, of course, take that at home. I'll time it. I don't know what it's going to be on stuff.
What time do you think you're gonna put the time?
Sometime tomorrow.
Like I don't know if it's like supposed to be before like class would actually be.
It'll probably be
or, like,
by the time class is over. I might have enough time to get it done today. So if I do, I'll open it today. So if you wanted to get it done today, you could. Okay. But up from like when I open it until probably, let's say 5:30 tomorrow. Okay. Any more questions?
Is chapter 13 on there already?
13 mind tap?
Yes.
Yes.
Yeah.
What about review?
I'll review. If not, I'll make sure that it
Okay.
is. I'll look at that. Yeah, so chapter 13 mind tap is due Sunday. Okay.
Oh, yeah, thanks.
When are we doing the CST comprehensive? Is that on Monday as well? Or is that,
Another exam?
I think so, yeah.
No.
Okay.
No, I know there was an exam that was open. That was open on accident.
Oh,
That
okay.
was from a class before, so no,
Okay.
don't worry about that one. No, I'll give you that one tomorrow, and then I'll give you another one next week sometime. And then we'll do like we did last time, do a comprehensive exam over everything, okay?
What did you put for 39?
PDF.
Yeah.
And also was chapter 13, did we have
Presentations?
Yes.
Yes, and I haven't gotten to those, so hopefully by tomorrow I can try to do those assignments.
Okay.
Okay. Yeah, keep you guys busy all weekend.
Were those corrections on the other exams due on when?
The corrections
Yeah.
are due by Monday.
So do you want us to
I
submit
think
to
at
you online?
10 or something like that. I think I sent an email. Excuse me.
So submit them online by email?
The corrections? Yeah, that's fine.
Okay.
Whatever.
Monday.
Yeah. So those corrections are due by Monday. I think I put 10 by 10 a.m. Okay.
And they're just the corrections that we've done on the last few tests.
Yeah, if you want points for the last, those 4 leading up to the comprehensive, then submit those
Submit the
You
corrections.
just want it like corrected on like a Word document,
You can.
or how are you guys?
I'm putting on a Word document and then folding the question and I might read one why they weren't correct.
Right. So you guys understand that, right?
Yes.
So for
Yeah.
each question,
Why each answer could
right,
be it.
why it couldn't
Why
be
it
it.
couldn't be it.
So that way, if you see that answer in a question someplace else, you guys will know what that means. And that's what I want you guys to know is what all those answers mean. Okay.
Would we still have to do it for like question number 1 or I think it was the first CST, question number 1, which was when would you hold your meal stand? It's after draping the patient.
Yeah, because why wouldn't it be the other ones?
But what if you did do after draping the patient, but it's considered wrong?
Oh, no, that's correct. So I'll go back in those once I receive your corrections and I'll fix that one. Okay. It'll remind me, oh yeah, I need to fix that.
I put a note on there, I'm like, I need to put a note. Like, number 1, that's still good.
Yeah, I was correct. Remember? Yeah, so if you guys ever question anything that you see in these tests, because sometimes when I'm doing it, it might accidentally move to the next answer. If you guys think, I don't think that's right, then let me know, okay? Because stuff like that happens. And then that way I can fix it.
Cool.
And I'm not correcting it forever. Yeah. All right, so you guys, Monday you guys will take the test and we'll start chapter 13. And Tuesday it's normal lab. Wednesday we're going to the hospital. At 3.
What time on Wednesday?
Wednesday at 3.
3, yeah, but I'm thinking that, and I'll let you know on Monday, that maybe before we go to the hospital, we'll go to the surgery center, just kind of swing by there. They know you guys are going to come by. I told them, I just like to take you guys by there so that way when you go there for observations, you know where to go, change, you don't look lost. Okay? So we'll try to do that before we go to the hospital.
So do we meet here on Wednesday?
We'll probably, do you guys know where the surgery center is? Yeah.
Mhm.
Yeah.
Unfortunately.
No, but across from the east or from the 30th San Juan College thing.
Oh,
Yeah,
up
it's
further west. So you know where, what's that street?
Is that the four corner of the
Yes.
Yeah.
You know where X-ray, X-ray Associates, yeah.
Yeah.
Orthopedic offices.
Yeah, it's right by
Where
orthopedic
the
office.
public library is,
Yes.
That
that
street.
intersection, just north of the.
Oh, okay, right there.
Farmington
Yeah, that's what I
Avenue.
was trying to get at, yeah.
So you turn
Farmington
in,
30th.
yeah, you turn in, right in front of you is the X-ray place. You take a right. You got to go around a little thing. You go to the very back. It's in the back.
Okay.
Okay.
So are we doing that?
Probably, but we'll talk about it again on Monday. And we're doing our potluck on the Tuesday before Thanksgiving, right?
Yeah.
Oh, on Tuesday, yeah.
Okay. Anything else that you guys planned that I didn't know about?
What are you gonna bring?
Oh,
The
yeah.
pies. The
Oh,
pies.
she's bringing pies. Yes, that's
I'm
right.
bringing some humble pie.
Yes. Yes,
With
that's
big
right.
old huge squash.
Yeah.
They're supposed to be better than pumpkins.
That's what
We're
I
gonna
said.
find out, but you
I'm
guys need to
sitting
be
on
the
the
guinea
wing.
pigs, because I have never tried it.
I'm the
When will our
Nothing's better than pumpkins.
Next week, let's see, when? I forget.
Is it the,
I think it's on the schedule, let me look.
on campus, it says like the 6th and the 7th, but it says we still
Oh, no. I have it for the 11th of December.
The final?
Yeah.
And the next Friday, we also have our CPR. So-
Yeah, yeah. Oh, yeah, that's what I need
And then
to
we
bring
bring
too.
$10, right?
$5 cash. Yeah, bring 5 because everything else comes with like $20. Nobody has change. If you're coming, will you just put a little X mark by your name and then just pass it around for CPR? Okay.
So we're gonna
For CPR.
Yay, I'm off. Bring $5. Yeah, so you'll be busy tomorrow and Friday and Saturday and Sunday.
Friday, we'll have to do for next, like, other one is.
No, probably tomorrow.
I used to.
So we have a mix due on Monday.
There's a test.
So-
It's online.
Oh, that online test that we're gonna
Test on Monday.
And mixed and they're doing
and a quiz test on.
Yeah. Yeah, so if you guys thought, oh, good, we don't have lab tomorrow and we get a break. No, you don't get a break. You got a test tomorrow, you gotta work on your next presentation.
Do you realize this is jeopardizing your position for most favorite teacher?
Yes.
Okay. Just making sure.
When
Did
you
you
guys
say
are
most
doing good in the
favorite?
OR, you'd be like, oh, she isn't so bad after all.
Okay.
Yeah, when they ask you a question about one of these crazy chapters, you'd be like, oh, I know that. When the surgeon says,
Yeah.
let's suture your lips together.
Technically, that one should be more deeper, but it'll go on my lips. He's gonna use an O.
Do you
I
want
know.
it absorbing or non-absorbable? I don't know, let's
He
see.
wants the plain gut.
The plain gut, yeah.
So that way it'll come out eventually.
Okay.
Yeah, stainless steel.
Stainless.
Everybody already did it?
Would you like the silk ties? Those are nice.
You guys? Yeah. Okay.
Yeah, I already have one.
And I think Giovanna's got your cards and all that, right? Cool.
Yes.
All right.
You bite your tongue.
Yeah, so next Friday, CPR for those
In
that
this class or?
in here, yeah,
In here?
in here.
At 8?
8.
Okay. Till
11:30-ish, maybe.
30-ish?
Yeah.
Till
Couple
all
hours.
this is properly-
Huh?
Till we can all properly do it?
I didn't know the college was open.
You would think it would be simple because it's just chest compressions.
Yeah, but it's all in
Yeah,
the
but I have to
timing.
go over everything.
Yeah.
It's all in the timing.
Your
The
ABCs.
the man that came in and talked to you guys about Bible science, he's the one who's doing the.
Oh, okay.
Hopefully we don't have to take the vital signs on them.
Yeah.
No, I'm just kidding.
I'll ask him. I'll say, Shayna needs you to go over vital signs with her again,
Right.
and she wants to try on you,
And
So we
it has
get
to be
to-
right.
and it has to be right. And what'd you say, Ron?
I was just joking.
You were joking with Rachel?
Do we get to learn the song that's supposedly allowed by the American Heart Association to keep running?
Yeah,
Yeah,
stay in
there's
the life.
there's two
Stay
of
in
them.
the life.
One is allowed and one is banned.
What?
One is banned. You cannot use it because it's the same rhythm.